I'm Dr. Asai here with a new sonography discussion on fetal dolichocephaly and brachycephaly. Don't forget to subscribe for every Monday new sonography discussion. Normally, fetal head has oval shape, but in some craniosynostosis conditions, it may be more oval or elongated, called dolichocephaly, and it may be more round, called brachycephaly. Both conditions are benign conditions, but their diagnosis is important not to misinterpret it with abnormal conditions like microcephaly, as we may find discrepancies in measurements. To diagnose abnormal fetal head shape, we use a ratio or value called cephalic index. The cephalic index is a ratio between biparietal diameter and occipitofrontal diameter. This ratio should be between 74% to 83%. Increasing the ratio shows brachycephaly and decreasing the ratio shows dolichocephaly. Now let's discuss a normal case with normal fetal head and two cases with dolichocephaly and brachycephaly. Here is a normal 30 weeks fetus with normal head. First of all, it's important to find the normal plane for measurements of biparietal diameter and occipitofrontal diameter. In a normal measurement, we should find the cavum septum pellucidum in 1/3 of occipitofrontal line, and we should also see the thalami. So in this normal fetus, if we calculate cephalic index, the occipitofrontal diameter is about 98 millimeters and the biparietal diameter is about 77 millimeters, and the cephalic index would be 78, which is in normal range. In this fetus, if we measure head circumference, it is about 28 centimeters, compatible with 31 weeks and 4 days. And if we measure biparietal diameter, it is 77 millimeters, compatible with 31 weeks and 2 days. And no discrepancy is noted between these two measurements. If we measure femoral length in this fetus, it is about 57 millimeters, compatible with 30 weeks and 1 day. And its abdominal circumference is about 26 centimeters, compatible with 30 weeks and 1 day. In reviewing the charts, we can see both head circumference and biparietal diameters are in normal range with no discrepancy to other measurements. Here is a fetus with dolichocephaly. Let's again calculate cephalic index. The occipitofrontal diameter is about 82 millimeters and the biparietal diameter is about 55 millimeters, and the cephalic index would be 67, which is decreased indicative of dolichocephaly. If we measure head circumference, it would be 23 centimeters, compatible with 25 weeks of gestational age. And if we measure by parietal diameter, it would be 55 millimeters, compatible with 22 weeks and 6 days. As we can see, it is discrepancy between head circumference and biparietal diameter. Keep in mind that head circumference is more reliable measurement in dolichocephaly and brachycephaly fetuses, and we can ignore the biparietal diameter not to misinterpret it with microcephaly or other fetal anomalies. Again, if we measure femoral length, it's about 48 millimeters, compatible with 20 weeks and 2 days. The abdominal circumference is about 20 centimeters, compatible with 25 weeks and 1 day. Again, if we review the chart, we can see that discrepancy is noted between biparietal diameter and other measurements. And our last fetus is a fetus with brachycephaly. We can see obviously that the head is more round than normal. Experted sonologists do not need to calculate, and they grossly diagnose dolichocephaly and brachycephaly. But if we again measure cephalic index, it would be 88, which is more than normal, indicative of brachycephaly. In reviewing the chart, we can again see the discrepancy between biparietal diameter and other measurements. If the video was helpful, please like it, and if you have any question, be free to ask it in comments.